Okay. All right. Good. So are we more or less through for what orthotics are good? Let's just say a person has a longer or shorter leg. Can or should that be fixed with orthotics?
Yes.
Or should that be fixed with just pulling at it long enough till one leg gets longer?
Well, when you have one leg longer than another, oftentimes we use an orthotic and we put a lift on the orthotic that's on the short side. Now, typically speaking, you can fit about 1/4 of an inch inside of a shoe. And most people can wear 1/4 of an inch lift inside of a shoe. If the difference is more than that, then sometimes it requires that something be added to the outside of the shoe to actually even a person out. Because when you have different leg lengths, you're going to have back problems, and low back issues are hugely important with people that have unequal leg lengths.
Right. Well, I heard from a chiropractor that almost everybody is a little bit out of alignment. You know, it's not always that he has a longer leg or a shorter leg. It may be part of the spine or part of the way whatever he grew up, posture, whatever it may be. How common is it for people to have just slightly, I'm not talking about the ones who have a whole inch missing, but, just the ones who have a 1/4 of an inch, 1/8 of an inch missing, enough that over a period of 20, 30, 40 years, they will have, as you said, back problem, spine problem, neck problem, headache probably, because of it. Well, what is the, they get, I heard many dentists actually saying that many people who get DMJ problem, meaning their jaws are not aligned, that
Sure.
Their mouth is not aligned, their teeth, that yes, it may start in the mouth, but it might just as well start at the legs, or somewhere in between, that the spine is out. And so he always works with chiropractors and with podiatrists to get it fixed, even if he may be the one fixing it. But he says if you don't get your legs aligned, and if you don't get your spines aligned, it will pop out again anyway. Have you noticed stuff like that?
Yeah, it's, there's an old saying, and it that I think everybody knows, and it says, when your feet hurt, you hurt all over. And frequently that's the case. If your foot is giving you a problem, you're going to limp on that foot. And when you limp, it changes your walking, and that throws your hips out, your back out, your neck. And so all of these problems cascade on top of each other. I mean, as the chiropractors, functional leg length difference, which is a term that's often used, simply means that the muscles really are unevenly tightened. And so you can have one of your hips pulled up a little bit, and it's not really that the bone is different, it's just the tissue is doing that. Now, if that were to stay that way for years, the bones are alive and they adapt to this position, whatever it is, and eventually it becomes a permanent situation for people. So treating these things is useful to prevent that type of a problem, for sure.
Right. Well, Dr. Grindstaff, very interesting. Appreciate your candidness. I think we kind of covered orthotics to, maybe not to the full extent, but to probably the most common extent. Thank you very much. Very helpful.
Thank you.